Hello, my name is Brad Wesselman and I am the Executive Director of TCCN. Today we'd like to speak with you about the Medical Legal Partnership, HeLP or HELP, which is available to patients and families who are a part of the Children's Healthcare of Atlanta family. This will be the first in a series of 3 videos. Today's guest speaker is Dr. Robert Petignano, the Medical Director for HELP. Dr. Bob, as he is affectionately known, has been a longtime advocate for the underserved children in our community, and he is here to describe the role of HELP in the community, the type of services that HELP provides, the type of patients who might benefit from those services, and how to identify potential cases where legal intervention is beneficial. Welcome, Bob.
Thank you very much for having me today. As always, it's a pleasure.
Absolutely. So can you start out and tell us a little bit about the history behind the Medical Legal Partnership and how it began in Atlanta?
Absolutely. Medical Legal Partnership actually was established in the early 1960s when a pediatrician realized that social risk factors impacted the health of his patients. And he also realized that those social risk factors could be corrected by legal intervention. So he went ahead and he hired a lawyer and after 6 months, realized that he was being very successful in addressing those social risk factors through the legal system. Hence, the Medical Legal Partnership was born.
So can you describe what that partnership looks like here in Atlanta and why it's important to community pediatricians and their patients and families?
Yeah, it's a little bit of a complicated story, but I'll give you the essence of what happened. Through the collaboration of Children's Healthcare of Atlanta, Atlanta Legal Aid, and Georgia State University College of Law, a collaborative effort was put together in order to establish the first medical legal partnership. It was the first medical legal partnership established in the Southeast and has been in existence since 2004. This program continues today and is even more important now as we face the devastating impacts that COVID-19 has had on these same vulnerable populations. The primary objective of this collaboration is to assist families with children who are exposed to these risk factors that negatively impact their health and well-being and have a legal solution. The risk factors are referred to as health-harming legal issues.
Okay. So in talking about health-harming legal issues, can you give us an example of what that means and what might be included?
Sure, the risk factors come in all different shapes and sizes and can be as straightforward as not having appropriate access to health care, or as complicated as challenges related to living conditions, family stability, or a myriad of other socioeconomic, cultural, and environmental conditions. One specific example is the child with asthma, who repeatedly comes to the emergency department, not because he isn't taking care of himself and giving himself his medications, but because he's in an environment infested with mold or insects, and every time we treat him, we send him back to that exact same situation, and that isn't being remediated by the landlord. This particular type of case is a perfect example of when the Health Law Partnership can intervene, because there is a legal solution to this.
What other types of legal issues do you see that can affect families?
Yeah, access to health care can frequently be a challenge for some families and is an example of when HELP can intervene and assist families in getting benefits. We can also address problems related to education, such as securing appropriate special education support and services in the school, monitoring school discipline problems, things of that nature. Other health-harming legal needs are things such as inability to secure medical leave, unhealthy living conditions that can negatively impact a child's care, food insecurity, and inability to obtain food stamps, securing custody of children left in the care of someone other than the parents. Because underserved communities historically have been unable to sufficiently advocate for themselves, HELP provides that legal safety net to ensure that their situations are brought forth to the appropriate individual for consideration and review. Our assistance in any of these issues may ultimately address unmet healthcare needs, unhealthy living conditions, or a variety of other conditions, all of which can impact a child's overall health.
So are there other components to HELP?
Yeah, actually HELP has 4 components. The first one we talked about were public health legal services. The second one is interprofessional education. We have residents and medical students from Morehouse and Emory University who get together with the law students from Georgia State University and some of the other professionals like social work, public health professionals, to look at social risk factors and how they can ultimately address them in their own practices in the future. In addition to that, we have a component for research. We want to substantiate how medical legal partnerships actually are beneficial to the community. And finally, we have an advocacy component. That advocacy component stems from, you see one patient with a disease, you see a second patient with a disease, you see a third patient with a disease. Well, now it's about time for us to look at those as a population health issue and figure out if there's any way for us to address their problems systemically as opposed to on an individual basis.
So overall, how would you summarize the benefits from the medical legal partnership that HeLP provides to the families and patients of Atlanta?
Yeah, the basic premise of the model is that by integrating legal services into the healthcare system, we will provide a robust interface to improve the health and well-being of individuals that may not have had the resources to advocate for themselves. Social risk factors are identified, and now, unlike in the past, through the medical legal partnership, we can offer a way to address those social factors. Ultimately, this model provides a higher quality of overall care and results in better outcomes for the child and family, and for services a more cost-effective approach to care. This, in and of itself, helps to reduce family stress, improves overall health of the children and of their families. For the community, it translates to a reduction in healthcare and educational costs. But more importantly, this collaborative effort contributes to enhancing individual child health and translates to improvement in population health over time.
Well, this has been incredible. And for more information on the medical legal partnership available to you, your families, and your patients, please join us for the next video in this series. We'll be discussing eligibility criteria and how to access those services for your families. Thank you to Bob for providing us with this introduction to the medical legal partnership, HeLP. We look forward to the next installment of the series. Thank you very much and have a great day.